This is the Fertility Friday podcast, episode number 30. Welcome to the 30th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. And as I had mentioned in some of the podcasts that I've recently done, one of the goals that I had when I first started this podcast was to create a community of women who can support each other while learning to chart, similar to what I had and was able to take for granted when I first started charting. And so I've recently created a Facebook group. So if you go to fertilityfriday.com/community, you'll be redirected to the group, and you'll just have to make a request to join, which goes to me and I'll approve you. And so the group is in the initial phases, and I hope that with time that we'll be able to build a thriving and supportive community of like-minded women who will help each other in understanding and gaining confidence using the fertility awareness method. So that's kind of my vision for the group. And as always, if you enjoyed today's show, please stop by the show notes page and leave a comment. You'll find all the podcast episodes at fertilityfriday.com/podcast. I love hearing from you, and you can also find me on Twitter at fertilefriday. And if you've been enjoying the show, I would absolutely love it if you would just take a moment and leave a review and a rating on iTunes. So this helps the show to move up in rankings, and it also helps more people to find the show. So I would really appreciate that. And in today's episode, I'm really happy to welcome my guest, Dr. Marie Wittman. So Marie has nearly 20 years of experience as a Pilates instructor. She has a doctorate in medical history and a certification in Merciér therapy. Marie has developed a multidisciplinary approach to reproductive health, and she specializes in reproductive health and fertility. She addresses the structural elements of optimal function in both women and men through her work. So today we'll be talking about Merciér therapy. It's something that's relatively new to me. I hadn't heard of it before, so we'll get into that and how that can help with fertility. And also we'll be talking about Marie's Movement for Fertility program and the role that proper alignment and movement can play in improving our overall fertility and health. So without further ado, welcome to the show, Marie.
Thank you so much, Lisa. Very excited to be here.
Well, thank you so much for coming on the show. And so I did give you a bit of a brief introduction, but I'd love to hear more about your experience. You've been in this field for quite some time, how you kind of came into the field and what inspired you to change your focus to reproductive health and fertility.
I have been a Pilates instructor for many years, 17 almost now, and I've always believed that a big component of our health is based on movement. So much of the world, and it's fabulous, is focusing on nutrition now and looking at how whole foods are important and things like that. But movement is a huge impact, has a huge impact in our health, and we need movement just as much as we need nutritious foods. And when I started charting, actually, through the fertility awareness method, I became aware of some of my own health issues. I had a very short luteal phase, about 8 days, very little cervical fluid, a low body temperature as well. So when I started looking at how I could naturally start improving these components of my health, because I wasn't trying to conceive at that time, I was really shocked to find that no one was talking about movement. There was enough information, I would say, not as much as I would like there to be or think there should be. There was enough research about too much exercise, like women running primarily, and how that could impact it, and too little exercise and obesity, and that affecting estrogen. But nothing in between, and no real strong recommendations of how much someone should exercise, what type of exercise. And so that to me is a red flag, just based on all my years of doing movement and knowing what movement does to our physiology. So I started doing some more investigation and came across, in a neighboring town from where I was living at the time, Jennifer Merciér. And she and I had several meetings at first, and I just was really trying to find out more information about fertility and thinking that this was a missing gap in what approaches were out there for women that were trying to naturally improve their fertility. So we met and we spoke, and she said, yes, you're right. This is totally a missing component, and I think what you have is a really great idea. So I also audited her certification in her method, and that's when I decided to become a certified Merciér therapy practitioner, was because I was blown away with the success of it and with the very non-invasive approach and how many women she's helped and how many women had gone through IUIs and IVFs and failed and been told, there were stories of women that had gone through 10 years of trying to conceive and then come and try Merciér therapy and then got pregnant naturally. Wow. So the method's super powerful. She has a documentary that's out that if you can get a screening of anywhere near you, I would highly recommend, because it's very moving and very powerful. And she's got evidence-based research that it's an 83% success rate of conceiving within a year of someone's treatment, which is, go ahead.
That's incredible, 83%. Yeah. I was going to ask, what's the name of the documentary?
Merciér Movie, I think, is just the name of it.
Yeah, I'll make sure to link to that in the show notes so that the listeners can kind of check that out, because it sounds really interesting. Yeah. So you've absolutely piqued my interest. I read a little bit about Merciér therapy to prepare for the interview today, but really I would just love for you to explain what it is and how it works.
So it's gynovisceral manipulation. It is totally external, so there are some approaches that are internal, but Merciér therapy is not. What we're doing is assessing the positioning and the responsiveness or mobility of the reproductive organs. So some people will be aware of the fact that the uterus can be positioned or pulled off to one side or be pulled to the back or pulled forward, and that can affect blood flow, which will also affect any chances of conceiving. And this is something that we can definitely address with Merciér therapy. Recently, I had a patient that her uterus was pulled a little bit to the right side, probably from some scar tissue of an abdominal surgery that she had in the past. And by her fourth treatment, it was more centered. Mm-hmm. And it was more mobile, I could feel it responding to my touch. We also do some other elements in the protocol that address ligaments and how the ligaments are responding to natural movement. So all our organs should be mobile and responding to our breath, to our movement, to our bladder being full or empty. And our lack of movement in daily life has an impact, as well as sometimes illnesses can cause it to be malpositioned, or surgeries, as I said, can cause it to be malpositioned, and this would affect your ability to conceive.
Okay, and what does the typical session look like? So I come to see you and you massage my abdomen, or what does it look like?
It's not really massage, so it's a little bit different than some of the abdominal massage approaches. It's more of a manipulation. It's not a manipulation of any bony structure, so it's still just of the organs. But the first session, we would go over your overall health. So we take an intake and kind of look at what other things could be potentially affecting your ability to conceive, or one's ability to conceive. And then you would lay down on the table, and we would work on kind of the position of your uterus and your ovaries, move some lymph around to make sure that that's circulating out, because there can definitely be a backup of lymph without proper movement, which is kind of where my movement stuff fits into this. And then we adjust position and then get a little bit into the muscle tissue around the pelvis and adjust or get into any trigger points perhaps where there might not be a good blood flow. Set the pelvis so that the ligaments that support the organs are more responsive to your natural movements.
Okay.
And then we continue the support over a year. So even though the treatments are only 6 weeks, plus a consultation, we continue to support the woman through her year of conception or trying to conceive, whether she's doing it just naturally. We just check in, see how, maybe if she's taking specific vitamins, or maybe perhaps there might be some kind of nutrition component that we might advise on. And if they're doing something like an assisted reproductive technology, then we're supporting them through that, looking at their tests, and let them a few ideas that they might want to discuss with their doctor as far as their testing, things like that. So it's also just helping them through and feel there's someone to speak to as well as they're going through the very trying issue of trying.
Mm-hmm. Well, and does it hurt? Is it uncomfortable?
That's a good question. I don't find it uncomfortable. Some women do. Primarily, the only thing that would be uncomfortable is when we're manipulating the uterus. And for me and for other women, it's kind of been just, yeah, that's a little bit weird. I'm not really sure what that is. I wouldn't want you to keep doing it forever, but it's not really painful. Other parts of it, some people might feel like a little bit of you would describe as like a burning sensation with the tissue, and it's very mild. And as your tissue starts to be healthier, then you feel that sensation less and less. So a lot of women are kind of able to see or feel immediately the impact that the Merciér therapy is having on their body, because they can tell where their tissues are moving, how the tissues are responding to touch and things like that. Does that make sense?
It does. So it sounds like then with your hands, you manipulate the woman's abdomen because you can actually feel where her uterus is located. And then through that process, you can actually determine if uterus is out of place.
Yes.
And then through your gentle, hopefully, gentle manipulations, you're able to guide the uterus back into proper alignment.
Mm-hmm.
And why does that make such a big difference with fertility? I know you touched on the fact that it improves blood flow, but maybe you could expand on that a little bit more.
Sure. Primarily, what makes it such a big impact on our fertility, and it seems like so basic, at least to me it seems so basic, is because of the blood flow and the lymph flow. So it's very important that we have adequate blood flow to all parts of our body. I think we all kind of basically understand that. But blood doesn't move only to the fact that our heart pumps it. It moves also because our muscles pull the blood from the arterial system into the smaller vascular tubes. And so that's why muscle function is really important for blood circulation, because if there is an area where the muscles aren't functioning, or they're functioning a little less optimally, then the blood flow is going to be reduced in that area, as well as the lymph flow. So waste is natural within our body, and the lymph is what carries that out. And it only moves with the muscular system. So if there's an area in our body where the muscle isn't working again, that lymph is going to start to build up, and it'll be very acidic for the cells. So the cells will start not turning over perhaps at the accurate rate, or they might not be turning over accurately. So that can definitely affect like function in an area of a tissue, because cells become tissues, they become organs. So this is an important thing for overall health. And
so lymph, so that's referring to our lymphatic system.
Correct.
And so could you just describe that a little bit more? So it's our body's way of removing waste, or could you elaborate on that a little bit?
Sure. So our heart pumps out blood, and it circulates through our arterial system, and it goes through smaller branches, and then it reaches through the capillaries and the nutrients within the blood, so oxygen and any kind of nutrients that we might be taking in, like vitamins or things from our food and stuff like that. That transfers through the walls of the capillaries to the cells. Then that fluid and then kind of continues on, and it moves into the lymph system, which is also vascular, same thing. Starts with capillaries and goes into bigger branches. And the cells produce natural waste whenever they are doing any type of metabolism. It's just a normal process like our body. And so the lymph fluid is then carried through another kind of system as far as vascular, and then is processed at lymph nodes, which most people kind of have heard of or whatever.
Yeah.
And those nodes tend to be concentrated in areas where naturally our bodies would have a lot of movement happening. And so it would help move and process out that lymph from our body. Those areas are our underarms, so like our arms, and around our hips. And because so many people spend a lot of time of their day sitting, and then when they stand up and they start walking around, we tend to have the same almost position of our pelvis when we were sitting, when we go to standing. So the range of motion that our leg goes through in our hip when we move or when we walk is not the full range it would have been. And so it kind of diminishes the circulation of the lymph in that area where there's high concentrations of lymph nodes.
Okay, so part of our body's detoxification system through our lymph nodes is actually the way we move our body.
Right.
And if we're not moving, then possibly this lymph is clogging up and just not fully leaving like it normally would. Okay.
Yeah.
And so then when a woman does the Mercier therapy and then aligns her uterus and is... Because you mentioned a patient with scar tissue, and then as you manipulated the uterus, it became more responsive and mobile. Yeah. And so that would help then improve circulation and improve the body's ability to remove the lymph.
Right, naturally, exactly. Yeah, so you're just optimizing your body's natural function. And so conception is a totally natural function in the human species. And I think that when someone's having an issue with conceiving, we kind of need to look at the whole body and see if we can detect where a system in our body might be not functioning optimally. And then addressing those, I think we can often come to a resolution that then puts reproduction back on the list of priorities. So if there's a part of our body that is not functioning optimally, our central nervous system and our brain are constantly monitoring this. So they know, we might not know that like there's a tissue in our body that's not functioning really well, but our body knows. And so it could be in a mode of survival, like I'm just trying to keep this person alive. And so reproduction becomes less of a priority because survival is more important than reproducing. Once we start to get tissues back to their optimal health and functioning, on all kinds of, there's multiple ways to approach this. I don't think that Mercier is the only way, or movement is the only way. I think they're just important parts of it. Nutrition is great, and acupuncture is great. There's lots of fabulous methods to optimizing health. But once we start getting our health back, then reproduction becomes a priority again because it's a very natural thing for our species.
Mm-hmm. Yeah, it's so interesting to me that the position of the uterus could impact fertility to that extent. One of the interviews that I did a little while ago is with Dr. Rosita Arvigo. And so when I was reading about the Mercier therapy, it sounded very similar to some of the aspects of the Maya abdominal therapy. And one of the questions I wanted to ask you is in what ways are those two therapies similar, different? Maybe you could talk a little bit about what distinguishes Mercier therapy from the Arvigo abdominal therapy.
Yeah, I get that question often.
I would imagine so.
So I'm not extremely familiar with Arvigo because I'm not a practitioner of it. I know that there is a self-care component of Arvigo. And the thing about Mercier is that what we're doing is we're really getting deep beyond your muscle tissues. And there's a tendency, especially on when you're manipulating the uterus, to back away because it's not comfortable. As well as there's side and back components. So there's parts of Mercier where we're working on the side of the body and the back of the body that one can't do on yourself. So I kind of alluded to the fact that sometimes I have done Mercier upon myself, so I know what it feels like. But there's parts of Mercier that I can't do on myself because it's areas that I cannot reach. So there isn't a self-care in the sense like that. So I think those are kind of the main differences. Again, Arvigo is is a great technique. I also, the one other thing I just thought of about difference between our Vigo is that there's a spiritual component to it, and Mercier therapy does not. And so there isn't a spiritual component to the work.
Okay. Well, what struck me as similar is the focus on the alignment of the uterus, and really kind of, as you mentioned, getting in deep and really making sure, because I know Dr. Vigo talked about getting the uterus in line and also the fallopian tubes, and just to kind of make sure it's all where it's supposed to be.
Yeah.
And I think what I find the most interesting about this approach is that it is non-invasive, and as you mentioned, it's so simple, the concept of having everything in the right place and having everything aligned. But I think the most striking part of it is how much it can actually help, and how few women actually have ever heard of it.
Yeah.
So one of the questions I wanted to ask you is if you could talk a little bit about what specific issues that Mercier helps with. So if a woman has a prolapsed uterus, or it's just certain, so if you wouldn't mind going into that a little bit and talking about what types of conditions that Mercier therapy addresses.
Sure. I'll start with the prolapse uterus just because you mentioned that and it's in my head immediately. That's not something that Mercier can necessarily address. However, that is something that within my movement protocol that for reproductive health that I can address. And it tends to be something that you often see more often with women after having a pregnancy and delivery, but that doesn't mean that it can't happen to women prior. And it's a mechanical dysfunction of the pelvic floor muscles. And so I think that a lot of the community addresses that issue by kind of focusing simply on the pelvic floor muscles and not really looking at the whole body and how something like somebody's breathing could be affecting the pelvic floor. That's not to say that there aren't some people that are. There are some PTs, especially I know, that do address that whole body component, but the majority kind of focus on like one area. So that's just specifically on the prolapse.
I'm sorry, I threw out prolapse uterus, but maybe you could tell the listeners what that means.
All right, so the pelvic floor muscles rest at the bottom of our pelvis, hence pelvic floor, and naturally they should respond to the loads that our body within the organs, like in our pelvic cavity and our abdominal cavity and our thoracic cavity, should naturally respond to the loads that those and the weight of those organs without any error, without any problem, without any dysfunction. However, alignment, going into the alignment can be off in people, and when the alignment is off, then those tissues, the muscles might not be in a position where they can generate the greatest amount of force to be able to respond to the weight of our organs when we're walking, for example, or if we're running. So in that case, then the organs that are the closest to the orifices of our pelvic floor can start to come down, or they can kind of move position and prolapse like into another area of the pelvic region. And there's different stages. So someone could have a prolapse that's not necessarily exterior to their body, or someone could have one that, for example, like the uterus or the bladder, can start to be coming all the way out, and they can even see it visually themselves and know that there's an issue. There's many ways to address that, and Mercier is not necessarily the first port of call to address that. It could definitely help with healing some of like the ligament stretch, which would happen, which would be because the ligaments in our pelvis also support our organs. So there's going to be an issue of the ligaments not supporting as well as the pelvic floor doing their job. But other issues that Mercier therapy addresses, it can help women that have endometriosis. It can help women with PCOS. It kind of is a supportive component. Like there's other things that women would need to be doing in conjunction with Mercier therapy for that, and if they're trying to do it also for fertility as well. So some people might come for just pain reduction in the treatment, but the majority of women are coming for fertility treatments. So there would be a multi-pronged approach to dealing with this issue, and we would work with the patient and what other practitioners, hopefully, as long as they're open, which usually they are, in working to address their health issues in multiple different ways. Other issues that, like women, if they're not ovulating, Mercier therapy can help increase the blood flow, again, move that lymph so that then the ovulation would be, kind of kick in naturally. People that have painful periods, so that might not be why they're coming for fertility, but it could be a component, and it will help position the uterus so that the uterus can easily shed the blood each month.
I was sorry to interject there, but I was actually going to ask you about painful periods and how Mercier therapy could help with that. So, how does aligning the uterus actually help to reduce a woman's pain?
Yeah. So when the uterus is positioned in a place where gravity isn't able to kind of assist the natural flow, so most of our expelling functions tend to be down with gravity.
Mm-hmm.
So gravity is assisting in moving those fluids out from our body. There's a few, obviously, coughing and vomiting that are up, but gravity is assisting in that downward pull. And it's the same thing with your menstrual fluid, so with your blood. So if the uterus is positioned such that it has a hard time expelling that blood, if it's flexed, then it has to work. The uterus muscle has to work harder to get that blood out. And that's why there's greater pain with periods. So Mercier therapy can adjust the uterus, put it back in its position. So naturally it doesn't have to work so hard to get the blood out each cycle. A lot of times women, when they start coming to Mercier, like the first cycle or second cycle, they'll have blood that is a very darker color because it had been kind of staying in there. It hadn't been expelling each cycle.
That is fascinating.
Yeah.
Side note.
The body is fascinating to me.
Mm-hmm.
It's so amazing. But also like movement classes or exercises, as long as it's working on getting your body aligned and working with the pelvis in the position that it should be, can improve painful periods. So a lot of women, when they start improving the alignment of their pelvis and its position to your rib cage, they start to have no pain at their periods, no Advil or anything else like that.
Wow, that's incredible.
Yeah.
So who is a good candidate for, is there anybody who, I mean, would you recommend Mercier therapy for every woman, or are there women who maybe shouldn't have it, or how does that work?
Definitely, we would never work on a woman that has an IUD.
Okay.
So that is one where we don't work with women. Anyone that has a inflammatory disease or issue within the pelvis, we don't work with them at that time. We might work with them in the future when it's cleared up, but not at the moment. I've definitely had women ask me about doing Mercier therapy early on when they're trying to enhance their fertility, but they're not trying to conceive right now. And for them, I would recommend more of the movement program that I have, because that's kind of a long-term natural approach to the same issues, like getting the blood flow and the lymph flow and getting the alignment. And Mercier therapy might be something that they would consider in the future, or if they're experiencing something that might indicate to me that their uterus is malpositioned and it needs a little bit more deeper approach or needs more care. Again, someone that's got really painful period, not ovulating, that would be another one where I would suggest that they do Mercier therapy. Women that are trying to conceive right now, I think of Mercier, the way that I have put the two methods together, which might not necessarily seem to go together, is that they're both trying to fundamentally kickstart our natural physiology. And one is just a little bit more intense than the other. Like Mercier is, I want to try and conceive right now. I've been trying for a while, or it's more of an immediate thing. And the Movement for Fertility program is more of a long-term approach. So some women who are maybe in their 30s and they don't want to have kids yet, but they want to make sure that when they do want to have kids, they're ready for it. That's more of a candidate for the Movement for Fertility program. However, a lot of the women that I see for Merciér therapy, I do either recommend coming to my classes or my workshops, or I sometimes teach them a few of the movements within their session as an additional component to their therapy, because it really complements the work and it makes it so that the progress I make in the session, the Merciér therapy session, continues throughout the week.
Okay.
Because a lot of the times, the reason that we're having struggles with our blood flow or our lymph flow is it's what we're doing habitually to our body, which I know can kind of seem a little bit frustrating, like it's my fault. But the good thing is that you can easily start fixing it. And a lot of the issue is that as a society, we move so little compared to what we were evolved to do, that our health is so minimal to what it could be. And so if you do a little bit, you actually make a big difference. So something as simple as not reclining back in a chair and sitting on your sacrum, which is the bottom part of the spine that's in the pelvis. Something as simple as that is starting to adjust the way that you sit and sitting on the two bones at the bottom of your pelvis, the ischial tuberosities. That can make a big impact on the positioning of the uterus.
Well, as you mentioned the Movement for Fertility program. Could you talk a little bit more about what it is and how it works and how it helps with fertility?
Mm-hmm. So it's a 6-week workshop type of course that I teach. And I teach women about the alignment of their bones and joints and how the muscle tissue can be affected when they're off from the right position. So we might think that we're doing an exercise for a hamstring, for example, but if the femur is positioned a little bit off than the way it should be compared to our pelvis, then we might not actually be activating our hamstrings. And then there's a lot of muscles that women aren't even really aware or have no consciousness of how to contract. And we should have the ability to contract all skeletal muscle. It should be within our somatic control. We should be able to think, I want this muscle or this area to work and have it happen. And so there's a lot of education in the program about finding certain muscles, especially within the pelvis. I do a lot of work of muscles that on the outside of the pelvis or the lateral hip or outside of the hip, and getting those muscles to really fire, which will increase the circulation in general in the pelvis. Getting women to know about hip extension, so the leg moving behind the pelvis, because the majority of people, again, because of chairs and couches and seats in cars and stuff like that, have little to no hip extension, which impacts the pelvic floor muscles, which impacts the glutes, which again all impacts the circulation within the pelvis. And then I also talk about, again, whole body. So I go to the upper body and discuss rib cage alignment, and we do exercises to help improve the alignment of the rib cage relative to the pelvis. And a lot of working on computers or driving in cars or anything forward, even carrying stuff in our hands, tends to create certain tension patterns within muscles that can kind of throw off the alignment of our rib cage and also affect our breathing patterns. And that, again, can affect the pelvic floor, but it can also affect circulation throughout the whole thoracic upper body area and also from the head and neck. So some of the exercises in the workshop classes are about improving the circulation from the head down to the body. So a lot of neck tension can decrease the circulation, which would affect hormonal circulation.
So I'm thinking that we've got a bunch of listeners who are now squirming in their seats. Maybe they're in their cars going to work or driving somewhere or sitting down somewhere, and all of a sudden really aware of the fact that their circulation isn't the greatest. So since every single listener won't be able to have the pleasure of coming to your class, which we'll of course talk about and link to, what are some things that we can all do day to day that can make us feel better about all the sitting that we do in our lives?
Well, being that we're talking during Infertility Awareness Week right now, I've been posting tips on my business Facebook page simply about simple things that we can start doing immediately within our day to start improving circulation. These are points that are in my mind immediately. One is trying to transition from sitting to standing more. So a lot of people are going to be familiar with the idea that standing or sitting is the new smoking. But really the issue is static positioning, whether it's standing, sitting, lying down, is the issue. So we just need more movement. So in general, just transitioning to standing workstation or standing when you're on the phone instead of sitting while you're on the phone, things like that will get more movement because you won't be used to it. So your muscles will get a little fatigued easily. So you'll kind of be fidgety. So that'll just implement more movement, as well as it'll help with some of so our muscles adapt to what we do. And so if we're sitting a lot, our muscles and our hamstrings and our quads and things like that, they adapt to make sitting easier for us. So if we do one thing a lot, then the muscles will adapt to that one thing. So if you're doing a lot of different things, it's better. So varying your movement, moving more, transition to a standing workstation as much as you can, trying to sit on your ischial tuberosities, on the two bones at the bottom of your pelvis. So usually I have women or men, because it's important for them too, especially for male fertility challenges, is to sit on something hard like a bench or a stadium seat that's on concrete or something like that. And if you sit at the edge and kind of move your pelvis back and forth, you'll find two parts that are bony, and you'll go, okay, I know pretty much what she's talking about. So those are your ischial tuberosities. So when we rotate our pelvis forward and back, front and back of the body, we want to be sitting on those two ischial tuberosities rather than kind of tipped back on our sacrum. Because when we sit back on our sacrum, it kind of puts pressure on the sacrum, which then pushes it in towards our pelvis. So our sacrum is mobile to some extent, which is important during birthing. But if we're kind of pushing pressure on it, then it pushes it into the pelvic cavity and can decrease the muscle tissue there, decrease the function of the muscle, which would decrease the circulation, stuff like that. So sitting in a neutral pelvis position.
So as you're describing it, I'm fidgeting, and
yeah.
and it sounds like it's what we should be doing then is not slouching.
Yes. Yeah.
Because as I was doing it, in order for me to get into that position you were describing, I kind of had to push my pelvis forward, and then my back is straight now.
Mm-hmm. Yeah. I think that what I'm trying to get more at is alignment of the bones rather than just a posture than sitting up straight or that kind of. But it is definitely kind of the same thing.
It's part of it, yeah.
It's part of it, exactly, yeah. So yeah, you can't slouch. You have to sit up kind of straight to get that position. What are some of the other things? Trying to learn about what really is stress versus stressors on the body, and thinking of what are some of the body's biological signals that you receive. So like an easy one is hunger. You get a hunger signal, and let's say it's in the middle of a meeting and you can't eat something at that moment. So you say, you ignore it, and then after a while you almost forget that you're hungry anymore. Well, that ignoring of the biological signal is actually a stressor on the body. So things like that, which a lot of people don't associate as being stress, because stress tends to be something that people think of as emotional or mental duress. But the fact that you didn't listen to that hunger signal triggers a bunch of hormones, stress hormones, that then affects your physiology. And over time, that's really what becomes chronic stress. So listening to your biological signals, so starting to become more attuned to your body and listening to what it says. So sometimes you could get a hunger signal, a thirst signal. Tired signal is one that I think a lot of people ignore. When you're tired, you either just don't sleep or you have a coffee or something like that. And it's hard in our society. I'm very conscious of this, but trying to start listening to your signals of fatigue or tired and taking a short nap or maybe going for a walk will help with addressing that signal that you really should be listening to.
Mm-hmm.
And also walking is a really important natural movement for the human body. So increasing your walking time as much as possible and trying to do it daily. I think that the the exercise recommendations that are out there right now are really too little for the amount that people don't move today. So the recommendation of like 20 to 30 minutes a day when most people sit all day and maybe like walked from their house to their car, from their car to their office, and then back again. And then that's just um, so much, so little movement that 20 minutes of exercise, even an hour of exercise, of intense exercise, cannot undo what happens in our body when we are sedentary for a long time. And I think that there's a lot of great apps out there that help people become more aware of how much they're sitting or how much they're still, because a lot of people when I work with them they'll say, "Oh, I'm moving all the time," especially moms. Like, "Oh, I have
Mm-hmm.
toddlers. I'm moving all the time." Okay. Well, do you sit down at a table to eat dinner? Oh, yeah. Yeah. And do you sit down at the end of the day on the couch with your partner after a long day? Well, yeah, I do that too. Do you drive in a car? Okay, yeah, I do that too. So, I think the apps are kind of helpful to become conscious of how much you aren't moving.
Mm-hmm. Well, and it's really what I really like about your approach is that you're bringing movement to light when that's not something that you would typically think of as being related to fertility. It's, you often think of diet or you think of, well, you just think of a lot of different things, but I don't think that movement is what comes to mind. And I definitely don't think that there's enough awareness about the power of manipulating the uterus and getting everything aligned because it's amazing the impact that that can have on your fertility. And one of the questions I wanted to ask as well for your Movement for Fertility program, how does movement and exercise and alignment help women who are planning to get pregnant or are pregnant? And how does that help with labor and delivery?
For women that are trying to get pregnant, it's really the fundamental of getting the blood flow and the lymph flow. And getting the alignment into it is that it allows more muscles to be doing that. So when we're out of alignment, there's just less muscle function happening. So research kind of indicates that we use about 50% of our ranges of motion. So it's very little compared to, when we're trying to conceive, we want optimal. Like,
Mm-hmm.
I don't want my circulation to be like a little bit or just enough because that's survival. I want my circulation to be optimal. And that's why I think we need to get more movement happening because it has such a fundamental component to our physiology. And there's a lot of really fascinating research happening today about, like, there's a whole now field on inactivity physiology. So always used to be exercise physiology and what happens to the body in exercise. But now they're looking at what happens when the body is still and how does that affect health. And there's also research on how the cells within our body respond to our mechanical environment. And the mechanical environment is our movement. And there's research or information now that the cells both respond to the mechanical environment by moving or deforming, but also then they then transfer that information into biochemical information that the body uses. So mechanical or movement is a huge component of how the cells in our body function, and that's really what we're talking about when we're talking about conception.
Mm-hmm.
And for women that are going to they're pregnant already and they're going to be going to birth, depending on the type of birth that they're planning for, again, we need those muscles to have the endurance for our labor. We need to have those muscles to be able to yield, which I think is what's missing in a lot of prenatal programs. Is a lot of it focuses on increasing the strength, which is important too, but our muscles need to yield, especially the pelvic floor, because if it doesn't give, it doesn't allow movement, then we can have um, stalled labor or there can be tissue tearing. So incorporating good stretches as well is an important part of tissue health.
Mm-hmm. Well, and I just have a few questions to wrap up today.
Mm-hmm.
So, given your experience, you've been working for women for a number of years now. What do you think is the biggest myth about fertility?
Well, this is I would say probably that movement doesn't impact fertility.
Mm-hmm.
Um, that exercise or that has no place within it. I think that's probably, yeah. I would say that, because it's not really known, as you
Mm-hmm.
kind of mentioned earlier, is it's just most people don't even consider that as a part of how they're approaching their fertility.
Okay, and for a listener who's tuning in and this is completely new to them until they tuned into today's podcast, they'd never heard of Mercier therapy, never really considered the role that movement could play in fertility. What is one thing that you would want to say to her to kind of encourage her to look into this further?
I would encourage her to start looking at how she can have ownership over her body's health. So I think a lot of times when we're struggling with fertility, we turn over all that to someone else. And what we're needing to do to be able to conceive is improve our health one way or another. And that no matter what approach you're going to do, like if you're going to do IVF, you still want your body to be at its optimal function because it's going to improve implantation, it's going to improve your pregnancy. So no matter what direction you're going, I think that people should really pay attention to the natural approaches because they support your body. And getting your body to be its healthiest is going to give you greater success no matter what approach you're choosing to do. And the power is with us. We have the power to research and learn and push back a little bit, I think, on whoever we're working with, and not to be controversial or to be difficult, but to really get the answers that we're looking for, and to pay attention to what kind of feels right with ourselves, which isn't an easy. We have to flex our intuition skill as just as much as we do our muscle skill.
Mm-hmm.
So starting to pause and listen to yourself and your own inner thoughts about your health, I think are important too.
I think what you said about intuition is so key. I feel that
Mm.
there's so many things that on some level women know and are aware of, but it's kind of drowned out, and intuition isn't something that's really encouraged or support, in our current day society. And so one final question for you, for a woman who's listening and she isn't ready to have a baby right now, but she
Mm-hmm.
knows she wants to in the next 2 to 3 years, and
Mm-hmm.
maybe she's on the pill, maybe she isn't. What advice, if any, would you give to her?
Um, I would recommend. Well, I'm a little biased because I think that the pill is not so great for our body, and I think that it will diminish your ability to read your own signals of what your body's telling you. So, as I said at the beginning, what got me into this is finding out about signals with my body, which I never knew before I started fertility awareness method, and I was using it as a birth control method. So I had no idea about cervical fluid and luteal phase, no clue. But that really triggered for me to do research and find out about what could be undermining my health that's causing that to be not working. Um, so I would recommend trying to become more attuned with your body and finding out what long-term approaches you can start applying to your life that will improve your health over time. Because especially if you're looking at your fertility long term, which is a really fabulous thing to be doing, then things like nutrition and movement and acupuncture, those are long term health um, approaches that do take time. So, even something like doing Arvigo and learning the self massage that you can kind of do yourself, that would be a very good thing long term, I think. And just trying to take care of yourself the best you can right now.
I think that's excellent advice. And so where can our listeners find out more about you, find out online? And I wanted to also have you tell the listeners where you're located in case anyone happens to be local and they want to come
Sure.
take a class.
Well, I'm located in Los Angeles at the moment. I wouldn't say I'm going to be here forever. And I just moved here in December. So before that, I was in Chicago. So I'm in the LA area for anyone that is in the LA area. But I also do a lot of lessons online. So I do Skype lessons, and I also am exploring doing workshops through online courses as well, so that many women can have access to the material. I'm also working with women like the Red Tent Sisters and doing webinars and stuff like that with them too.
I love them. Amazing.
I know. Yeah, I love them too. They're great. So my website is artandscienceofbalance.com. And I also have a Facebook page, Art and Science of Balance, as well. And Twitter is at La Pilatessa, LAPILATESSA. And I'm always more than happy to answer any questions for women, give tips. Obviously, movement is my wheelhouse, but I do read up on a lot of things, and I do a lot of research, especially with my medical history background. I pull a lot of context into fertility long term and what information we can kind of gather from that as well. That was all the areas, right? You wanted to know where I was located?
Where you're located, where we can find you online. And so I'll definitely link for your website, Facebook, Twitter in the show notes. So don't worry about having to remember any of that. Just come over to fertilityfriday.com/30. We're into the bigger numbers now, so
Yay!
Woohoo! I can't believe it's episode 30. But thank you so much, Marie, for being here. I really enjoyed chatting with you today, and I'm really just excited to share this information with the listeners. I think that movement and alignment are such an important piece of the fertility puzzle that no one is talking about. And so I'm really glad that you're in the world and that you're helping women to discover just the power of movement, especially giving women non-invasive options to support everything else that they're doing.
Thank you. I was very happy to be here and to speak about it. Very happy to help get the word out about this in general. And it is super powerful because just as a personal experience, I was both doing a tiny bit of Merciér, as I told you, and my movement program when I teach. And without trying, despite my luteal phase and my my very little cervical fluid, recently conceived. So it's just, thank you. So it's just a testament of how powerful it is because I had those health issues and was not trying. So yeah, so it's very powerful work, and I'm very happy to be part of the movement of women and men helping women and couples conceive.
Mm-hmm. It's such important work, and I absolutely love it. And so yes, thank you again for being here.
My pleasure.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You can find me on Twitter at Fertile Friday, or stop by the blog and leave a comment in the show notes for today's episode if you enjoyed it. I'd love to hear from you, so you'll find the show notes at fertilityfriday.com/30, so the number 30. You can also find me on the Fertility Friday Facebook fan page, which is facebook.com/fertilityfridays with an S. And you can also check out our new Facebook group, which is fertility, which you'll find at fertilityfriday.com/community. And of course, if you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so that more people can find it. So thank you for listening. And as always, until next time, be well and happy charting.